This is a video about how to help your child if they're preparing to go to a therapy appointment. Or it can also help therapists know how to handle a therapy appointment, specifically for an autism spectrum child who doesn't know what to expect and needs some idea about what's going to be covered in an appointment. The same kind of thing can be done for other kinds of appointments as well as for a therapy appointment. It's just I'm a therapist, so I'm going to talk about what that would be like if they were coming to see me. However, you can use a similar strategy if your child is going to a doctor's appointment or a dentist's appointment or to get a haircut. Now, the way that I've done it also is geared towards children who can read. And I work mostly with kids who have high-functioning autism or Asperger's syndrome. But you can also use a similar method for children who can't read but using pictures. However, the example I'm going to use is one that's for psychotherapy or counseling, and it's geared towards children who can read. But as I said, the strategy of using a visual support and a structure to what happens in a session could be applied to kids with other kinds of needs or going to other kinds of appointments. So when I see kids on the autism spectrum for a counseling appointment, I like to give them an idea of what to expect and how the visit will go from one step to another. I also find that most kids, whether on the autism spectrum or not, do not want to come in and only focus on problems that have occurred. Now again, this is maybe something a little bit unique to psychotherapy, but it's pretty hard for kids to think, oh, I'm going to go in there and talk for 45 or 50 minutes just about the problems that I've had. And so I really like to keep a positive focus, and yet we also do need to address problems because that's really why they're there, because if they weren't having any problems, they probably wouldn't be coming to see me. So I like to try to find that balance. So I use a visual support, and in the top of it, it reads, what do we do in therapy? I have this up in my office, but if you were doing this as a parent, you could do it before they went. You might want some consultation with the provider to make sure this is, of course, how they're going to do the appointment. But you could work this out with your child's provider. So what I have for my structure is I say, we talk about good things that have happened since you were last here. And I have a little smiley face. So I let the child know that we're going to be, I'm going to ask them about 2 or 3 things that have gone well since their last appointment. Now, some kids are extremely detailed in their presentation to me about things that have gone well, and so maybe we'd just do one. It depends on how long it takes them to tell me about one good thing that has happened, and sometimes they can't remember, and so their parent might be helping, for instance, with that. But I want them to know that I see them as more than just having some problems, and I want to start things out on a positive note. Then I have, the next sentence says, we talk about behavior problems that have happened since you were last here. And the next one says we talk about feeling problems that have happened since you were last here. Now, in usual course of events, those things just sort of get combined. But there's reason I have both of those there is that some kids are more readily able to identify one than the other. And so I want them to know that I care about their feelings, about what they're thinking and feeling on the inside, and I also care about their actions or their behavior. So sometimes they might have a problem with feeling angry, and that might come out in a behavior problem of, say, having a tantrum. But I want to be able to validate some of those feelings and just talk about, you may have a problem with having a very strong emotion, but there could be an appropriate way to handle that or an inappropriate way to handle it. So I have those there, although we, generally speaking, don't first talk about behavior problems and then talk about feeling problems. We just talk about it all together, just in terms of how I run my therapy session. Then I have a next step which says we fix problems about feelings and behavior. So my goal as a therapist is to have heard about some good things that have happened, to have heard about some problems, and then come up with some kind of plan that the child and family will be using to try to address that situation. So a lot of times we're looking at things that have to do with changing how a child might react to something. So maybe if they get really angry, for instance, if they're having a problem with angry feelings, they're going to a calm down spot and using some different things that they've set up for themselves to calm themselves down. And if you're interested in that, check my video list because I have a video on how to help a child set up a calm down spot. or we could be focused, for instance, on what the parents are going to do differently. Like maybe instead of telling their child, you will do this right now, for instance, they might say, I would like you to do this and you could either do it before or after dinner. Or I would like you to do a chore, but you could either put the dishes away or pick up the family room. You know, that they're going to start giving some choices. So that might be the kind of problems that we're trying to fix, and we're coming up with a plan that they're going to try to use after they leave my office. And then the last part is I say, if you've behaved well while you were here, then you could pick out a prize. Now my standards for good behavior during a session are pretty basic. It just means they have to come to the therapy appointment. They have to stay in my office and not take off and not be aggressive, generally speaking. Occasionally I might hold them to a slightly higher standard, so if someone's having a super hard time participating in any appropriate way, you know, I might set up what that standard would be for them to pick out a prize. And I have a treasure box that has some little prizes that are often things that a child in the autism spectrum might like. There's some different trading cards and some candies and some little toys and things like that that someone could pick out. And again, I just try to be very gentle about it and how I describe it. I said, I have some things in here that you might like, and if you would like one, you can pick one out. You know, so because sometimes they say, you don't have anything I like. And so okay, you don't have to pick anything, you know, but it's something you could pick if you would like to. You know, so by having the structure of the visit, then the kids have a better idea of what to expect and to how to participate. And I sometimes use a visual timer as well that shows them how much time is going by in the session. So I turn it to 45 minutes, and it has a red for the 45. It's called a time timer, and the time gradually, as it goes down, the red gets smaller until it's all the way gone. And so they have another visual support that lets them know how long they need to be there. Now, not all appointments are timed the way a therapy appointment is, but sometimes they are, and if that's the case, some kind of timer like that might help as another form of a visual support to help the child know what to expect. So as I said, this is the kind of thing that can be adapted for a number of different settings, going to a doctor's or going to the dentist or coming to therapy. You could also use pictures. So for instance, if a child's going to the dentist, you might have pictures about you know, arriving and getting teeth cleaned and getting checked by the dentist, you know, and then maybe they often have a prize too that they could pick out. So it's a use of visual support and helping kids know what the schedule is and what to expect during appointment. My name is Barbara Lester. I'm a licensed clinical social worker. I have almost 30 years of experience working with children and adolescents, and I specialize in working with children on the autism spectrum. If you're interested in these kind of tips, please subscribe to my channel on YouTube, which is ASD Specialist. And thanks a lot for stopping by.